So good afternoon, everyone. I'm Dr. Veronica Kelley. I'm the Behavioral Health Director for the Department of Behavioral Health here in San Bernardino County. I know there are folks who are still joining, but we're going to get started because we only have this lunch hour. I want to welcome you and thank you all for your interest in your own well-being. We have received a number of questions, so at the end of the presentation, I'm going to try and answer some of those. We will, however, answer all of them in writing and send it out to everyone who registered, with the exception of a few people who asked questions and wanted those to be anonymous and sent directly to them. So for those of you, don't worry. We also, on the last slide, have a list of resources for you, so hopefully you'll be able to make use of that. And there was a question about whether this webinar would be, or WebEx would be available, and yes, we are recording it, so we will also make that available to you all. So I've shared my screen, and I'm going to also be sharing some actual techniques and walking you through some coping skills to deal with anxiety. And when I do that, I'm going to take us offline. You won't see the PowerPoint anymore. You'll just see me, and I might even, that way I can show you how the techniques are done, and then we'll kind of practice them. But that's how we're going to go, and so I'll just start from here. Like all pandemics before this, COVID-19 is impacting everyone's mental health. So we have had pandemics previously. So SARS was a pandemic. Pandemic meaning it's an epidemic that is impacting either an entire nation or the entire world. And COVID-19 is impacting the entire world. This is the first, though, of our generation where we are experiencing things a little bit differently than they did with the flu in the earlier part of the century. So pandemics, let me see, so hoping you guys can all hear me because I'm unmuted, but pandemics are a major social and psychological impact. So it's not just about the physical, the disease. The most impactful for many of us is the stuff you can't see, the social and psychological. So we know that the pandemic is impacting employment. For all of us who are county employees, I myself count myself as very lucky that I have a job during this pandemic. But for adults in the United States, we identify ourselves via our job or our career. And so to lose that or to have that impacted is devastating to our personal identity. And for your households, and I know, I'm sorry people are having difficulty with the sound, so I just ask for you to check and turn your own volume up because I'm unmuted. But for those of us who are employed with the county right now, our partners, our spouses, our significant others might have lost their job during the pandemic. And so that shifts things. It increases everyone's anxiety. We start to not only have a loss of our sense of self or who we are, but we also are nervous about making our mortgage, paying our rent, paying our car note, all of those things that we usually do, we're more impacted. And too, it also depends on the position you have with the county. If you are someone who is in a lower paid position and your partner at home loses their job, it increases your stress, absolutely. Another huge impact is family separation. And while maybe not all of us enjoy our families that much, a lot of us do. That's our support system. And to be physically separated from them and unable to hug someone that you've normally hugged on a regular basis is very difficult. This is particularly impactful when we're talking about our elders. And if your parents are living somewhere and you usually go and see them on special occasions or you go for a summer vacation, that's impacted now. And it's not the same. And you might be very worried, especially if you have an elder who's living in a care facility. And so we're going to talk a little bit about that because I know some of you had questions about that. And remember, this pandemic is really affecting the way we live. Obviously, we all have to have stockpiles of masks. We all have to be very cognizant of our physical hygiene and social distancing. It's impacted the way we play. And so for our children, but also for us, when we're going home on the weekend, we usually do things. And now those things have changed drastically. And absolutely, it's affected the way we die. And what I mean by that is we can no longer mourn or grieve the loss of a family member or a friend or a colleague in the way we have in the past, because we can't gather. And so remember that funerals and wakes and rosaries are time for us to get strength from one another after we've lost someone. Those are rituals that are really for the living, not for the deceased, and we can't do them. So it has absolutely impacted every aspect of our life. And we do know from research that the mental health impacts we're experiencing are going to last far longer than COVID-19. We have learned that through SARS in particular. And what we saw in SARS is not only were those impacts happening, the impacts of the disease SARS, but also there was an increase in racism targeting particular groups of people. And so all of those things really do increase the amount of stress that all of us are feeling. So what we've seen in the world is an increase in a lot of things, an increase in suicidal ideation. So that's thinking about suicide. And if we think about this county in particular, we have seen an increase in calls for help. We haven't seen yet an increase in completed suicides, but that's because the data is gathered post. So we won't have that data until this time next year. But I can tell you the Department of Behavioral Health has a contract for a mental health line. We have our crisis line, and then we have one for our mental health line. And that is through an agency called the D.D. Hirsch Center. And what we know is in February, stay-at-home order, the D.D. Hirsch received 21 telephone calls from residents in San Bernardino County. And those are our usual folks, people who have a mental illness, people who are struggling. What we saw in March was an increase to 1,800 calls. And then in April, 3,000 calls. And in March and April, the callers stated that the reason they were calling was because of COVID-19. We also see, obviously, an increase in anxiety. I have an increase in anxiety. I know my staff, my family, perhaps all of you. And that is a normal response to an abnormal situation, which is what we're going through. There is a difference between feeling anxious and having an anxiety disorder. So I want to make that clear. And the difference is about the length of time that someone's experienced symptoms and some other things that would require a diagnosis. But feeling anxious, I think we all are doing that. We also are seeing an increase in depression, feelings of sadness, feelings of isolation, and we're seeing an increase in diagnosis of major depressive disorders. We also are seeing an increase in loneliness. Remember, as human beings, we're social creatures. So it's weird to be 6 feet, 10 feet away from other people. I'm a person who gives a lot of hugs. This is really weird for me. For those of us who are in the business world and we shake hands a lot, this is weird. So it increases our feelings of loneliness. If you are telecommuting and you have underlying medical conditions, then you might experience an increase in loneliness because you are isolated at home. And we'll talk about some things you can do to decrease that. I did want to talk about, and what we're seeing is an intimate partner violence increase. We used to call that domestic violence. So we are seeing that, and I wanted to point this out for supervisors in particular, as some of our departments are allowing telecommuting. We have many staff. I will tell you that we've worked specifically with some departments on this in the Department of Behavioral Health, who have staff members who are hesitant and do not want to telecommute. And I would suggest that you be open to the reasons that they might not want to telecommute. We've had some staff who were very adamant they didn't want to. And when it came down to it, after our supervisors discussed it with them, it's because it was unsafe at home. Their partner no longer had a job and they were being abused. And so we offered, obviously, some support there and a way out. And so we have those resources that we can absolutely share, but we are seeing an increase in intimate partner violence. Our domestic violence providers are seeing an increase in calls, but then that leveled out because people are home with their abuser and they can't make a phone call. So just something to consider. And we are supposing that there is an increase in child abuse. Now, our Children and Family Services Child Abuse Hotline has not seen any huge increase in calls, but I want to remind everyone that the people who usually make those calls, mandated reporters, are doctors, camp counselors, teachers, and our children are home. So they are not there where mandated reporters could actually see them. So we are supposing that there's also an increase in episodes of child abuse. So this is really important because I think people believe stress is psychological, absolutely, but it is absolutely rooted in physiology. So it is a physical response that we are having. We know that stress and trauma is cumulative. That means it piles on. So imagine, think about your own life. If you have a history of some traumatic event that happened in your childhood, it's there. And then you have COVID, and that's on top of it. And then you have social unrest, that's on top of it. And you are worried about your children because they're not going to school, that's another layer. All of that builds up. And then there just might be one thing, right? Like your husband doesn't put the top back onto the toothpaste, and that's like the straw that breaks the camel's back. Again, stress and trauma are cumulative, and so we have to deal with them, reduce the stress and trauma so that we can function. So the part of your brain that takes over when you're super stressed or you've experienced a traumatic event is the lower part of our brainstem. So we have our forebrain, our higher level functioning happens there. We have the midbrain, and then we have our reptilian brain or our lower brain. And so that's what's activated. And so if you think about it, that makes sense, right? When you are experiencing something traumatic like a car accident, there's a part of your brain that takes over and you just respond, a reflex, if you will. That saves us. That is protective of the human experience. And so another way you can think about that is if we were, and I understand this is not historically correct, but in cave people days, if a cave person were out hunting and came across a tiger, their brain is telling them a couple of things. The brain is saying to their body, okay, dump some of these hormones into the bloodstream so we can get the heck out of here. So our brains still function that way. When we are experiencing extreme stress or trauma, our reptilian brain says we better get activated. And so our brain dumps adrenaline into our bloodstream. It dumps norepinephrine into our bloodstream and cortisol into our bloodstream. And those things help us get ready to run or to fight. And what they do is increase our heart rate. And when your heart rate's increased, it's sending blood away from the core of you into your limbs, your arms and legs, so you can fight or run. It also, though, draws it away from your brain. And so especially your frontal lobe. So it pulls it from your organs, and it pulls it away from the part of your brain, the frontal lobe, where judgment happens. And so our perception is altered. We get literal tunnel vision, as well as figurative tunnel vision. Some people experience a difference in hearing because they're focused on survival. Our brain focuses us on survival. And that's really important, but it can be very negative and have a lot of impacts. So in addition to that, you might be triggered into this kind of a response. And I'll give you an example. And I'm going to talk a little bit about December 2nd, so I don't want to trigger other folks. But December 2nd, in this office where I was, and for behavioral health, we heard all of the helicopters. And so it was constant, and when we looked out our window here at our admin building, we could see all of the first responders lined up. So I've gotten through all that trauma. We've done all of our response. We deal with crisis every day in the Department of Behavioral Health, and I'm pretty good myself with crisis. But 2 weeks ago, we had a field fire behind our building, and I noticed that there were fire trucks outside. There's also a fire station there, but we saw them. They were different. They were placed differently because they were fighting a fire. And the helicopters were dropping water on it. And so that sound of the helicopters was a trigger for me. I was wondering, I realized I was getting more agitated and feeling more anxious. And that's because that was a trigger to a previous experience that I had, that many of us had, which was through December 2nd. So it's really important to remember that that's all there, that they're connected. And so if you are feeling overwhelmed and you know that you are feeling stressed, or that you've had something traumatic happen, especially with COVID, that it's not just something in your head. It's literally a physiological response that makes all of us safe. And so a good thing to remember is the reason this is happening is your body's trying to protect you. And it does protect you in some ways, but it also can negatively impact you. So really important considerations for our mental health is that behavioral health has to be part of all of our disaster responses. And I will say, big shout out to the Department of Public Health. We've been a partner of public health for years. And so us actually being asked to do this webinar is, I think, an indicator of how we are part of disaster response. And I also want to say, in behavioral health and DBH, we talk a lot. And we process our feelings a lot. I am very aware that the Department of Public Works might not be as amenable to that as part of your everyday work. So the fact that the county is really understanding that we have issues because our mental health is absolutely impacted. And let me remind you, you all have mental health. We all have it. We just want good mental health. So the county is allowing these sorts of webinars to happen. And then we also have some additional resources. The county did just sign a contract for an employee assistance program that started on July 18th. On my last slide, I have the information for it. But that's a resource that all of you can use, as well as your family can use, that is free, in addition to your own insurance, right? So it's a free service, and I'll talk a little bit more about that. Another important consideration is that we need to think about the behavioral health of our frontline workers. And so many of them we know naturally as our healthcare workers, right? I know we have folks from ARMC who are on this WebEx. That's really important, and that's a no-brainer. That people who are taking care of our sick at a time when there's a pandemic absolutely have to have their mental health tended to. The problem is, for those of us who are clinicians, we're not the best patients. And so it might take a few times for us to realize that, oh, maybe I need to address my stress. But I am also talking about with frontline workers, those folks who have continued to help our country and our county move forward. Many of them are you, right? So our mail carriers, for our general service workers who are out there driving between different spots, for our public works folks who are making sure that the roadways are still intact, all of those things. Our grocery clerks, that we all understand that. Folks who work in purchasing for the county, who make sure our books are in order and that we're paying all of our bills so we can get our funding in. Truck drivers, our Southern California Edison gas providers, because they're coming out to our homes now to make sure everything's okay. We need to ensure that their mental health, their behavioral health is addressed. And I'm going back and forth between behavioral health and mental health. Behavioral health really just includes addiction. So when you hear me talk about mental health, I'm talking also about addiction and recovery. It's important that we also focus on strength and resilience of our communities rather than deficits. It is really easy to get into blaming behavior and start to say, well, it's because those people. And that's not helpful. Our communities are very strong. In particular, San Bernardino County strong. We have been through a lot, and we will get through this. We just have to focus on the goal, which is to wear face masks, wash our hands, stay home when we're sick, practice social distancing. And if we do that, we can get through this. The part that's really important for you all to consider is what you're doing right now, which is attending to your mental health. We need to build protective environments for behavioral health. I don't know if 7 years ago anyone would have attended a WebEx on mental health. So what we've seen is a decrease in stigma. And it's essential because, again, we all have mental health. So we need to make sure that we reduce stigma, that people feel fine about going and seeking behavioral health care, because it's just like physical health care. Your brain is part of your body. And we've seen an increase in resources because the Department of Human Resources has engaged us in this employee assistance program, and that's an additional resource for all of us to attend to our behavioral health. Another thing is we need to focus on high-risk populations, and I'm not necessarily talking about people over 65, or people with underlying health conditions. I'm talking about disparities in healthcare that existed pre-COVID that we're now seeing very clearly. Some of us have always seen it, and for some of us it's a new thing. But it is very difficult for some of our communities of color and people who are living in poverty at times to access effective health care, and that's really important. Also, we need to focus on survivors of COVID. There are many people who have survived this. In my office, we have a number of folks who have survived COVID and they're doing great, but they've lost something. We know that there's a lot of stigma around people who say they're COVID positive. I know even the feelings I get when I hear we have a staff member who's tested positive in our building. It gives me a little jolt. And that's part of the stigma, because we're afraid that it's going to get us, that we're going to take it home to our families. So we do need to pay attention to that. And for the families of people who've lost their lives to COVID, they are experiencing a very different impact to their mental health. And then remember that this is not just an event. COVID is impacting each of us very differently, and so it really is about your interpretation of the event. If you are someone who is, or maybe you have a family member who's homeless and has an addiction and a mental illness, they're going to be impacted by COVID a little bit differently than you if you have a job and insurance and you live in a house and you have family for support. So I also wanted to just address, because there was a question about the impact of the social unrest during COVID. And I do want to call that out, that some folks, we've been talking about the two pandemics. COVID-19 as a pandemic, and then inequity as a second pandemic. And so for that, I just want to point out that racism and discrimination do make us sick. There are mental health impacts. And those impacts look just like impacts of extreme stress and trauma. And so there's some other things that we need to consider. We need to seek services when we need them. And I know a lot of people ask, how do I know when I need services? Where do I find services? So as a county employee, you should have health insurance. And some of you who are might also have Medi-Cal or another kind of insurance. All of our insurance will cover some level of mental health treatment. It would be really important too, when you're seeking services, that you look for someone who might have experience in whatever you're dealing with. So if it's racial trauma, someone who has experience in that. If it's simply stress and trauma, someone who has experience in treating that. And our employee assistance program, which is through LifeWorks, has the ability to provide you services. In fact, the HR has sent out that link, but we're going to make sure that you all get it. And it's a free service. I will tell you, I've gone on the website, I've gone through it. It's an app you can download on your phone as well. You can call and talk to somebody. It is 100% confidential, or you can look on this website and find resources and even toolkits for yourself. So again, we'll make sure you have that. I do want to let you know, though, when you do call the number, to get services or to talk to someone, they will ask you your name and they will ask you where you work. And I'm not saying that you say I work, on 5th Street or for public health or whatever. You would say that you work for San Bernardino County. And that's so they can keep track of that. So there is that. They also have the ability, I think, to do chats and are going to be doing some webinars themselves. But that is a service that's available, and you can actually have a consult. So be able to speak to someone for up to 5 sessions for each incident per year. And all that information is listed on the handout that we will send to you all. Another important thing to do to address your mental health is to protect your peace. That's a fancy way of saying if there's a place at your home or on the road or at the beach where you can physically distance that brings you a serenity, that makes you feel safe, that you need to protect that space. And so, for you, ensure that you're not bringing negativity into that space. That's really important. Another important thing is to practice joy-based practices. That means just do stuff that's fun for you. And while the stay-at-home order has impacted that a little bit, there's still things you can do. I have a 22-year-old daughter who is a rave person. So she goes to raves all the time. So obviously, raves are not happening now. And so that brings her joy, which then brings me joy. She's not bothering me. And she joins raves virtually. There are virtual everything that we can do. Maybe what brings you joy is swimming in your pool. Maybe what brings you joy is exercising. All of those things. So important that you remember what brings you joy and try and do what you can to do that. Activism is a really great way to feel in control when most of us are feeling out of control. We want to be part of the solution, not part of the problem. And this has been really effective for folks who are addressing the response of COVID and the stress of staying at home, and then wanting to be active in equity practices. So you can sign petitions, you can donate money, but become an activist. Really a great way to take control of our feelings. And when we feel in control, our anxiety reduces. It goes without saying, but I need to say it, we need to prioritize our mental health. You all have done that. That's amazing. Your mental health is important. And that means that you have to take a few moments out of every hour to do some of the practices I'm going to walk you through, then you need to do that. Consciously respect boundaries. That means, remember, you can't do everything for everyone. And so if today is not the day, today is not the day. Don't do it. And then finally, observe your thoughts and feelings without becoming them. You can feel angry, but you don't want to become anger. You can feel frustrated, but you don't want to become frustration. And many of us, it's all one. We become our feelings. So I'm going to take you through some exercises. Now I'm going to stop sharing this PowerPoint. Okay. And so this is what I'm going to ask you to do. We're going to do two things. We're going to do some breathing exercises, and we're going to do some mindfulness. So before you get freaked out about what the heck is mindfulness or any of that, I'm going to walk you through it. So breathing, I want you to remember the slide where I talked about the physical things that are happening to your body, right? So when your body is activated and you're stressed, that's our sympathetic nervous system happening. When you do really good breathing and you practice it, that activates our parasympathetic nervous system, which calms us down. It's our brain's way of saying, calm it down. Breathing, we all do it, but we probably don't all do it really effectively. Most of us are shallow breathers. We breathe in our chest. I'd like you to just think about for a moment, when you're listening to something that's stressful like the news, I suspect you're holding your breath. So what we really need to do is engage in breathing, because that gets oxygen, right? So we get oxygen. The breathing sends a message to our brain to calm down, stimulates the parasympathetic nervous system, it increases oxygen, which gets to our brain. And that's what we need, is our brains to calm down so we're not so focused on fight or flight. So what I'm going to do is I'm going to talk about the breathing, then I'm going to do the breathing, and then I would encourage you to do the breathing as well. Right? It's just breathing. It's not a big deal. So what we're going to do for the first is we're going to inhale for a count of 4, hold it for a count of 7, exhale for a count of 8, and do that 4 times. So we're not going to do it 4 times, but I'm going to show you what it looks like. It's just breathing. So you're going to inhale for a count of 4, hold it for a count of 7, exhale for a count of 8. Easy. So now let's all try and do it together. We're going to inhale for a count of 4. 1, 2, 3, 4. Hold it. 1, 2, 3, 4, 5, 6, 7. Exhale. 1, 2, 3, 4, 5, 6, 7, 8. Inhale for 4, hold it for 7, exhale for 8, do it 4 times. You can do that anytime you're getting agitated. You can do it when you're sitting at your desk at office. You can do it when you're at home and your kids are in the other room. Anytime. You can do that driving. I've done it often driving. What it does is, again, tells your brain, relax. There's no danger right this moment. Really important. Second, breathing. This one, I'd like for you to sit down. I'm going to stand because I'm standing, but you want to sit in a chair and get comfortable. You're going to, again, I'm going to walk you through it, kind of show you how it's done, and then we'll do it together. So you're going to sit in a chair. You're going to ground yourself. When people say that, they just mean put your feet or your hands on a surface, because that then tells your brain, okay, I'm solid. Sometimes when we're super anxious, we feel like we're spinning out of control. But if you physically touch something, it breaks that connection in your brain, and your brain says, oh yeah, okay, I'm okay. So you're going to sit in a chair, put your feet about a little bit more than shoulders distance apart. You're going to sit up straight, so pull your back up off the back of your chair. Put your hands on your thighs, and now we're going to start with an exhale. So remember, I'm walking you through it first. So you're going to exhale out of your mouth, and you're going to empty your lungs of any air. And then you're going to close your mouth, and you're going to breathe in. You're going to fill your belly. This is a time, don't suck it in, okay? We want you to fill your belly, and after your belly, then your chest will get filled. You want to bring air fully into your belly. You hold it for a count of 4, then you open your mouth, and you exhale. And then you do that 4 times. Something magical about the number 4. So I'll show you. Pretend I'm sitting. I'm going to exhale first. And when you're exhaling, you want to pull your belly button in, so you're taking all the air out of your belly. So pull your belly button in towards your spine. So then you're going to close your mouth, and then you're going to inhale deeply and fill your belly. Your belly should look down at it. It should extend a little bit. Fill your lungs. Hold it for 4. And now open your mouth and exhale. All right, so now we'll all do it together. So sit comfortably. Make sure your back is up off the back of your seat. Hands on your thighs. You're going to exhale first. So you're going to open your mouth and exhale all the air you have in your lungs, pulling your belly button towards your spine to get all the air out. Then you're going to close your mouth and deeply inhale. Fill your belly and your chest. Hold it for 4, 2, 3, 4. Open your mouth and get all the air out. That's easy. 2 easy breathing exercises. And if it gets too convoluted for you, it doesn't matter how you do it. Count to 10, take a deep breath, anything to get your breathing more regular. And the better kind of breathing is belly breathing, to relax you, to reduce your anxiety, to remind your brain that you are okay in this moment. And so again, I'll send you that information so that you'll have it and you can practice it. And remember, it seems odd that we'd have to practice breathing, but we do have to practice breathing. Now, mindfulness is the next thing you can do. Mindfulness is a fancy psychological word for quieting your brain. So most of us are thinking right now of 100 things. We're thinking about, God, I wish I had time to eat lunch. I can't wait to get these resources. I wonder what my dog's doing at home. Did my husband pick up the groceries I asked? Whatever it is, but our brains are constantly working. And that adds stress. So what we want to do is clear your mind. And for me just to say to you, clear your mind is not effective. So we're going to do a couple of things, and these are very easy. So the first thing that can help us with mindfulness, and again, mindfulness kind of breaks us out of our anxiety and centers us and makes us feel in control. Doesn't take a lot of time. So yawning and stretching for 10 seconds. So I want you to try and yawn, even a fake yawn. So what a yawn does is it stops you from thinking about anything. Think about when you've been speaking publicly and you yawn. You're not thinking about what someone's saying or what you're wearing. You just yawn. Physiological response that we're not really sure what it does, except for maybe draws more oxygen in. So you're going to yawn. A fake yawn is perfect. And then you're going to stretch for 10 seconds. Okay, so we're going to yawn and then stretch for 10 seconds. And when you're stretching, I want you to pay attention to where you might find some tension in your body. And then if you're really open to doing this, you can say things like, relax, or ease, or even hello, whatever. Because what it does is draw your brain's attention to that part of your body. So you can say it in your mind if you want, if you feel silly saying it out loud. But so a good way to be mindful, yawn, stretch for 10 seconds. And so I was just thinking, my back is tight. And because I thought that, my attention went to that, and it stopped me from thinking about my groceries. Another thing, too, that you can pay attention to with stretching and yawning is where you carry stress. So a lot of us carry it up in our shoulders, some in our back. I must clench my teeth all day long. I always notice that my jaw is super tight. So relaxing your jaw is super easy to do, and you just have to open your mouth a little bit. I don't mean like mouth breather kind of way open, but just a little bit. Relaxing your jaw is a really effective way to stretch. Okay, the second thing, mindful exercise, is called stroking your hand, which is exactly what it is. So what you're going to do is you're going to, remember I'm going to tell you, I'm going to do it, and then we're going to do it. So stroking your hand is just to lower your gaze or soften your gaze, and then you take your right index finger and you will run it on your left hand, down each finger, and then you will switch and do the other hand. So I'm going to do that now. Lower my gaze, take my finger, and I'm just going to run it along each of my fingers, switch hands, do the same thing. What that did was make me focus on my hands, and I thought, gosh, I need some lotion. But it really does help you focus on something else. So I'm not thinking about, God, I feel so stressed out about work. I'm thinking about my hands. Seems like an overly simplified coping skill, but that is exactly what mindfulness is, just blanking out your mind. The last thing is called STOP. So it stands for stand up, tune into your body, observe, and possibility. So first thing, stand up and breathe. We just talked about the importance of breathing. So everyone, again, I'll say them, and then I'll do them. You guys can do them with us. So you're going to stand up and breathe. The point of standing is to feel the ground. Right? If you're curled up in your bed or you're sitting in a comfy chair, you're not grounded. Put your feet on the ground, stand up. It gets your body into a position where you can breathe a lot easier. The second thing you do is tune into your body, like what we just did, and figure out where you have some tension. So you can where you're having emotions. Some of us, when we're nervous, we feel emotional. We might feel it in our chest or our bellies, but that's what the tune into your body is about. The O is for observe, and that doesn't mean observe yourself. Now we're going to look outside and observe something in your surroundings. So this would be a great time for you to find something on your desk that's amazing or beautiful. I do not suggest that you focus on a screensaver as a beautiful thing, because if you're at work, you don't see that screensaver, right? So a focal point, for those of you who have delivered babies, bring a focal point, something you can look at that's beautiful. You're just observing something outside of you and being thankful for it. Super easy to do. And then the P is for possibility, which is just giving yourself a break, giving yourself some grace, and thinking about the possibilities that exist for you as a person. So stop. It is stand up, tune in, observe, and possibility. So I'm going to ask you all, stand up. If you're seated, make sure that your feet are flat on the ground so you can feel it. If you need to kick off your shoes, do that. Then you're going to tune into your body. You're going to pay attention to any emotions or feelings, stress you might feel in your body, good and bad. Then you're going to observe, lift your eyes outside of yourself, and you're going to observe something around you that's beautiful. I have pictures of my kids right down there, so they're usually beautiful, so I'll look at them and be thankful for that. And then the P is an internal kind of philosophical thing. Like, what are the possibilities? Maybe the possibility is just that you're going to get something done today, or that you are going to say a kind word to somebody else, or that you know you're so excited because you got through the day. That's the possibilities. So super easy things. It is really easy for folks to overthink how we handle anxiety, and the answers lie within us. Now, obviously, there are some folks who will have higher levels of anxiety and who might need professional intervention. I'm not trying to discount that at all, but I want to make sure that you all are aware of that. So now I'm going to, I'm not going to share my screen yet. What I'm going to do is go over our questions, and we received a lot of questions from folks. And again, we will be sending out the PowerPoint and make the recording available. So we got a lot of questions. I'm going to try and get through them. Sorry I've been talking really fast, but I want to get to these things and leave you all with something. So one question was, how can I get restful sleep? And let me tell you, I've tried everything myself. As a woman going through a particular time in her life, restful sleep is difficult. But really important, remember that our bodies have a natural clock, right? The circadian rhythm, that's what it's called. And what's really helpful to keep circadian rhythm in tune is natural or bright light. So if you're seated in an office that has soft light and you're in an office for 8 to 10 hours a day, it's not helpful. So bright lights. If you can open a window, especially if you're telecommuting. But if you're in the office like I am, I open up my windows as much as I can, and when it's hot, that's difficult. So another suggestion would be to go on a break outside. Get some natural sunlight. That is helpful for our circadian rhythm. You need to decrease your blue light exposure. So light's great in the day, it's not good at night. And by blue lights, I think you all know what I mean. I'm talking about your computers, your phone, even television. And so the scientific evidence is that 2 hours before bed, you should stop looking at that. And I'll tell you, I'm someone who also keeps, I might go to sleep watching SVU or something. So that's difficult. But reducing that is really important. What we know is when you have all that blue light, like you're scrolling on your phone at night, it tricks your brain into thinking that it's still daytime. And so your brain won't turn off. And it impacts circadian rhythm. Avoid caffeine. And there's lots of research that shows even 6 hours before bed, caffeine's still kicking in your body, and it is a stimulant. Try not to have long or irregular naps. Some people are lucky enough to have a nap in the day, a quick cat nap, that's fine. But long 2-3 hour naps are not good for your circadian rhythm. They throw it off. Make sure that you can try and get into a sleep routine, meaning you wake up at the same time and you go to sleep at the same time. That's hard because some of us want to try and sleep in on the weekend. Really, really hard. But try and do it. It will help you if you have difficulty with sleeping. You can consider melatonin, and I talked to your physician about that. A melatonin supplement will help because melatonin is a sleep hormone, and if you don't have enough or something's interfering with it, then a supplement might be in order. Alcohol, reduce alcohol intake before you go to sleep because it interferes with human growth hormone, which impacts melatonin, and so it messes up the circadian rhythm. Even though it's a depressant, and you might think, it helps take the edge off, what it really is doing to your sleep is messing it up. And then you can make your bedroom a really nice place where it's quiet. Light is thought to be even more disruptive than outside sound. So if you have sleeping curtains that you can use, or even an eye mask, if you need to have that, that would be really important. And then have a clear mind when you go to bed, which is harder, but I think that does bring you back to try one of those mindful things we talked about. So that was the sleep question. Second question, stress and anxiety in coworkers, how do we address it? And this is, I believe, from a supervisor. It is really important that we talk about this stuff. And again, you're all on here, and so people are open to listening to it. Even in a staff meeting, you could talk about, make sure you're all taking care of yourself. You can remind people about the Employee Assistance Program that can give lots of information on reducing stress. It can be part of what you actually do is create, download a packet of stress reduction techniques and hand it out to your staff. Those are really important things, but it is also important that you as a supervisor talk about it. Just because we talk about being stressed doesn't mean that increases our stress. It actually decreases it if we talk about it. Really important question was about senior facilities, right? And what to do if you have a parent or an elder in your family who is in a facility. So there's a lot of stress around our elders because of the comorbidities that many have and that they're a little bit higher risk. If you have someone who's living in a care facility, call the care facility and find out what their policies and procedures are related to COVID, because they all have to have them. And then make sure that the facility has your contact information. Give them multiple ways to get in contact with you. Phone, email. Find out if visiting is allowed. If the visiting is allowed in a courtyard. Find out all of those things. Make an effort to have phone calls with your loved ones. That will help you, absolutely, but it also will help them. But I think finding out what the facility is actually doing is really important. And please know that in San Bernardino County and Riverside County, there are some strike forces that are going out to the skilled nursing facilities. And the Department of Behavioral Health is accompanying public health and some folks from ARMC and EMS. And we're going out cold calling every skilled nursing facility in this county and moved on now to other congregate care facilities, providing assistance with policies and procedures, giving them PPE, and DBH is actually doing some crisis intervention so that the staff's level of stress is reduced so they can stay and provide effective care. So great questions about our elders. Next one is, how do you deal with loss during COVID, specifically grief and the loss of someone who has passed away? And so, again, really important for us to remember that grieving is going to be different for everybody, but absolutely it's different during COVID. And the rituals that we've utilized to help get us through are no longer occurring. So consider creating a new ritual. So that I have a staff member who just lost his father. It's been very, very impactful for him because his father is in a different country. And for him to fly there, he will have to quarantine for 2 weeks before he can go and be with his family. It's not realistic to be able to do that sort of a thing. So what the family did is they did a virtual funeral, and they engaged their temple in assisting with that. And so I think you'll find, if you're thinking creatively, folks are really trying to do what we can to address grief and loss. So see if the funeral provider is open to doing things virtually. You can find out if a cemetery is open, so you can go and give you can go there and give your respects. The difficulty lies in wanting to be with someone when they are in the process of moving from this world to the next and dying. And so again, that's going to depend on the facility. It's going to depend on you. Some hospitals will allow visitors, some will not. And that depends on if someone is experiencing COVID or not. This is an unfortunate thing, but it's great that we're talking about it so we can be prepared when it happens. Another question is, why is it harder to step away from the computer at home rather than work? And so I wanted to ask a question back, but I am just going to say, when you are at home and you're on your computer, it really might be your only tie to people. So when you're at work, even though you're social distancing, you see other people. If you're telecommuting and you're home and you have medical problems, you might not see another person. And so technology is essential for you, and that's an important thing. But remember that technology is a double-edged sword, right? So it's important to set some intentional time when you're going to be on technology. You want to, if you're using social media, filter your feed so that you're getting only positive content, because overindulging in negative content and reading the comments of everyone's posts is just going to agitate most people and most brains. So we don't recommend that. You want to read stories on your computer and social media from trusted sources. And just because I put it as a post does not mean it's true. You want to avoid the news. Reading it, hearing it, watching it right before bed. It activates your mind, and you want to have a calm mind to go to bed. And then turn off notifications for social media. I mean, do you really have to hear or read every single time somebody in particular tweets? No. So it's really important for you to address social media, and that was a great question. Health issues, and there are some folks who have stated that they have some comorbidities, some underlying health issues, and they're worried about coming back to work. Follow the CDC guidelines. Those guidelines are wear a face mask at all times, practice good hygiene, wash your hands, stay home if you're sick, and physically distance. And I would also suggest, if you're very, very worried about that, to consult with your physician, and then also to consult with your supervisor to see if there is a way that you could possibly telecommute. Every program is different, but that might be an option. Let me jump to, how do we talk to kids about this? How do I deal with my kids? And so really important to remember, your kids are getting their information about COVID from the very same places you are. Okay. And it is really important that we as parents or caregivers are calm and reassuring to our children. It doesn't matter if they are 3 or if they are, my 22-year-old still lives with me. It doesn't matter, they're still your kids. They're going to take a cue from how to behave by watching you. So if you're angry or agitated or screaming and yelling all the time about, I don't want to, I don't want to social distance or whatever, your kids are going to do the very same thing. Let your kids know that they can talk to you about any of this stuff, any of it. And many of us might think we have amazing relationships with our kids. I always think I do. I have a 13-year-old. And I did go out of my way to say, hey, River, if you want to talk about this, I'm here. And then he said back to me, again, I'm a clinician, and I thought I had a great relationship with my kid. And he said, if I do, will you get mad? So I think as parents, we have to get out of our way, out of our own way, and realize what our kids might think about us. So make sure that you let your kids know that it's safe for them to talk to you. Avoid blaming language, so don't say things like, well, COVID is because of those people. That's not helpful for your children, and then they will replicate that, which is not helpful for them. Obviously, reducing screen time, really important. And then do what we have always done with our kids. Remind them to wash their hands, cover their mouth, give people space. And when you're talking to your kids, make sure that you use simple language. Let's see, how you deal with fear about going out into public. Know your facts. And if you reduce your exposure to media, that will probably help. But get the facts. CDC is our solid place to get facts. What we know about the virus has changed, but the virus itself hasn't changed. So we know, we follow the guidelines, we wash our hands, we wear a mask, we keep physical distance from people, and we stay home if we are sick. Really important. And remember, a mask is not a substitute for physical distancing. Because you put your cloth 3-layer mask on does not mean you can now go and hug your neighbor. The physical distancing is the most important part. So that's really important. And practice some of the techniques, breathing and mindfulness that we talked about. We have 3 minutes, and I saw we had a whole bunch of questions that came through. I do want to remind all of you that I will be answering all the questions, and we'll be sending them out. No one will be able to tell who asked what question. And for the people who ask for anonymous answers, of course, I will respond to you independently. We will make sure that you have the information, but I did want to, again, tell you, I'm going to share my screen while I keep talking to you. These are some resources that are available. So our County Employee Assistance Program, the EAP, is at lifeworks.com, and the information on it has been sent out to you. There's the 800 number, and we'll make this PowerPoint available to you. You can always call DBH's COVID crisis line. We have phone numbers and texts, so if you don't want to talk to a person, you can certainly text us. And those are available free, confidential. You don't have to tell us your name or anything. A licensed clinician will pick up the phone from 7 in the morning until 10 at night, Monday through Sunday. You can always check the CDC's website. You can look at the dashboard for information for the Department of Public Health at sbcounty.gov/DPH. Our website in DBH has a lot of information. And then I've listed a couple places where I pulled information from. So, I have to give credit where credit is due. This is not all some of it's my thoughts, but some of it is not. So balancedblackgirl.com has a lot of great resources about how to do self-care. Real Depression Project is a great Instagram site that has a lot of information. Therapy for Black Girls, and don't get hung up on that, it says Therapy for Black Girls. It is a great resource, lots of information, and some ethnic-specific information that is absolutely pertinent for today's world. And so that hour went by quick, and I want to make sure that you all, I want to respect your time and thank you all for tuning in, and we'll see if we do this again. But we'd like to hear back from you on whether this was helpful. Again, we'll send back the questions. Maybe we just have a session where we have questions and answers, and we can also bring DPH to have some medical professionals speak as well. But I hope that you can make use of breathing and mindfulness, clearing your brain. And remember that there's a bunch of resources available. We want to thank all of you county employees for being here and doing the work you do every day for our communities. And until next time, we'll catch you on the well side.